Hello and welcome to Curevive, where we believe in the power of natural healing. I'm Dr. Yash, your guide on the journey to better health. Today, we are starting a new series to explore the various diseases beginning with diabetes. Whether you or your loved one has been diagnosed with diabetes, or you simply want to learn more about this disease, you are in the right place. By the end of this video, you will understand what diabetes is, how does it work, what are its symptoms, and some tips to manage it. So, let's get started. What is diabetes? Diabetes is a condition that occurs when your blood sugar or glucose levels are too high. Glucose is your body's primary source of energy and it comes from the food that you eat. But for glucose to be utilized in the body, it needs a little help from insulin, a hormone which is produced by your pancreas. In people with diabetes, either the pancreas doesn't produce enough insulin or the body can't use the insulin effectively. This leads to an accumulation of glucose in the blood, which can cause various health problems over time. So now let's dive a little bit deeper into the pathophysiology of diabetes. When glucose builds up in the bloodstream, it can cause hyperglycemia or high blood sugar. This condition is harmful because it can damage your blood vessels, your nerves, as well as organs over a period of time. For example, chronic high blood sugar can lead to heart disease, nerve damage, as well as eye issues. The technical term for diabetes is diabetes mellitus, and there are different types of diabetes like type 1, type 2, gestational and others. But regardless of the type, the underlying issue is that the body cannot utilize glucose properly. So let's look at the types of diabetes quickly. Type 1 diabetes is an autoimmune condition where the body's immune system attacks the insulin producing cells of the body. Type 2 diabetes, which is the most common form of diabetes, is where the body either does not produce enough insulin or the cells become resistant to insulin over a period of time. Gestational diabetes develops during pregnancy and usually goes away after it, but increases the risk of developing type 2 diabetes later in life. Then there is pre-diabetes, which is when the blood sugar levels are high, but not high enough to be classified as type 2 diabetes. Recognizing the symptoms of diabetes is crucial for early diagnosis and management. The common symptoms which can be seen with people who usually suffer from diabetes are increased thirst and dry mouth, frequent urination, fatigue, blurred vision, unexplained weight loss, numbness or tingling in the hand or the feet, slow healing of sores and cuts, frequent infection like skin infection, fungal infection, yeast infections. These symptoms can vary in intensity and may develop slowly, especially in type 2 diabetes. In type 1 diabetes, symptoms can appear more suddenly and more severely. Managing diabetes effectively involves several strategies, including monitoring the blood sugar levels, taking medications as prescribed by the doctor, eating a balanced diet, as well as staying physically active. It is also important to maintain a healthy weight, manage your stress, avoid smoking and excessive alcohol consumption. Regular checkups with your healthcare provider are essential to ensure that the diabetes is well managed to prevent any complications. If you found this video helpful, please give it a thumbs up and subscribe to the channel, as well as share it with others who you think might benefit from it. Don't forget to hit the notification bell so you won't miss the next video in our series. We'll be diving deeper into how to manage diabetes naturally and effectively in the coming videos. Join our community to learn more about living healthier and a more balanced life. Thank you for watching, and remember, the journey to self-revitalization begins here with Curevive. Thank you for watching and stay tuned.